Whether you're a student, physician, caretaker, or patient, our goal today is to help bring insight to better understand the importance and complexities foundational to enhanced shared decision-making. As many of you already know, shared decision-making allows for patients to actively participate in decisions pertaining to their care. The webinar this evening will include a panel discussion and will be followed by a facilitated Q&A. But before we begin our panel, I'd like to introduce Dr. David Armstrong. Dr. Armstrong is an internationally recognized leader in the field of podiatric surgery, diabetic foot, limb preservation, tissue repair, and wound healing. He's a professor of surgery at the University of Southern California and the founder and co-director of the Southwestern Academic Limb Salvage Alliance, a clinical and research collaborative. He is also the founder of the American Limb Preservation Society and serves on the advisory board at Vascular. Dr. Armstrong, thank you so much for being here.
Oh, Stephanie Lou, thank you for having me. This is absolutely spectacular. And by the way, hello from beautiful downtown Phoenix and the Hyatt Regency. Here I am now at the Symposium for the Advancement of Wound Care, and it is so I'm going here and then I'm going straight into another meeting, but I wouldn't miss this opening for the world because, you know, students connecting with patients and caregivers and learning from the very, very beginning that it's this dialogue that really makes the biggest difference. You know, I mean, actually, this is the beginning of Limb Loss Awareness Month. It's the beginning of so many things for you guys as students for putting this on. But the fact that you're getting this kind of dialogue and talking about shared decision-making with other caregivers and patients is spectacular. And I know you already know these data, but I'll just give them to you again. Right now, we'll talk about diabetes. We can get into the rest of PAD in a minute, but every second now, someone around the world develops a wound on their feet or their legs. And about half of those get infected. About 20% of those will get admitted to hospital. About half of those patients now in the United States and in the EU and other parts of the developing world have peripheral artery disease, or you'll also talk about CLTI. And that's why 20% of those end up getting an amputation, which they get admitted. So there's now a wound every second, give or take, and there's an amputation every 20 seconds. And there is so much that we can do collectively to make a difference, to kind of turn back that clock, and importantly, to help our patients and their families move through the world a little bit better. And the fact that you guys are starting as students in understanding this from a public health sense just leaves me with a ton of not just enthusiasm, but just hope for the future, because the present, as tough as it is, I think there's great promise. The future is frankly limitless. So here's to that. Linnell, thanks for putting all this together too, by the way, FYI. This is just spectacular. You're like the den mother for the whole enchilada here. So this is really, really great. And thanks to Vascular Cures and the American Public Health Association and everyone else. JD Shee, also my former fellow, and now look at him go. You guys are great. Onward and upward.
Thank you so much, Dr. Armstrong. So I want to go ahead. Before we begin the panel, I want to introduce our amazing panelists. So first off, we have Pam. She is a patient with a history of PAD. Thank you for waving, Pam. And she currently lives on the East Coast, and she is an educator herself and is very passionate about educating her students about PAD and lifestyle modifications. Peter is a caregiver, and he's local. He's in San Francisco, and he is a full-time proxy to his dad, who was diagnosed with CLTI. Barbara is from the South, and she has been newly diagnosed with PAD. And last but certainly not least, we have Kim, who is joining us also from the South. She is a registered nurse and was a full-time caregiver for her mother, Gertrude. Gertrude was a CLTI patient and a double amputee. All right, Stephanie, I'm gonna kick it over to you.
All right, so the first question is, with regards to your experience as a patient or caregiver in reflecting on your initial interactions with a healthcare provider, what are some things that stick out in your mind that went well or could have been approached differently? We'll start off with Kim. Kim, I think you're muted.
Okay, hello everybody. To answer the question, my experience with the healthcare providers is probably a little different than everybody else's because I actually worked at the hospital where my mother was getting her care. And I had a kind of a personal relationship with a lot of the doctors. So not only would I talk to them on doctor's appointments, I would talk to them at work and they would tell me things at work. I had some of their phone numbers and things like that, but so that went well as far as being able to talk to them. But early on, you know, my mother had wounds and stuff like that, and there was no cardiologist on board as far as like her treatment and stuff. And she was diabetic. She became diabetic like in her 50s, but she started having these problems in her 70s. So it was good that I had access to the doctors right there at work, but I still didn't have there still weren't all the proper doctors that needed to be on board with her care.
Thank you, Kim.
Just one quick thing, you know, Kim, something that stood out to me was when your mother was recovering from a procedure. Can you share a little bit where she was placed in the hospital while she was recovering because there was a lack of resources?
So when my mother, so we're from a small town in the Mississippi Delta called Greenville. I don't know if you all have heard of Greenville, Mississippi, but it's like one hospital. The nearest metropolitan hospital is like 2 hours away in Jackson, Mississippi. So my mother had a procedure in the cath lab. She had an arteriogram with stents and balloon placement, and they put her on the postpartum floor. And after her procedure, she had a hematoma, and she came back with a film stop on her leg. And at the time, I was currently an ICU nurse at that time. And the nurse took the film stop on, waited a couple of hours, and was like, "Oh, Miss Campbell, you can go home." And I told her, "No, you can't send my mom home. She has a hematoma." And she was like, "Well, it's midnight." And I was like, "You need to call the doctor." And I had the doctor's phone number in my phone. And I was like, "But I'm trying to like help you because if I call him, you're gonna be in big trouble." She was feeling faint, and they had some fluids hanging. I was like, "You need to open up those fluids. You need to call the doctor because he's coming right now to squeeze the hematoma out. You probably need to get some labs because if she has a hematoma, that means she's bleeding somewhere. She needs like a CBC and a chemistry." So the doctor that was performing the procedures didn't have a designated area in their hospital with properly trained nurses to even take care of those patients if it was a complication. So I had to use all my knowledge and resources to be able to help my mom during her illnesses.
Thank you, Kim, for sharing that.
All right, Pam, over to you.
Thank you, Stephanie. Good evening, everyone. It's good to see some familiar faces and some new faces as well. I was diagnosed in 2009, and my first thing was with a general practitioner. And when I went in, my toe was purple. And he said, "Oh, this is a vascular problem." So I immediately found a vascular surgeon. Upon going to see the vascular surgeon for the first time, I was notified that I had to have emergency surgery. being an educator, health and physical education educator, I had no idea what was going on. So I immediately had them call my brother so that he could explain to me why I had to have this emergency surgery. But I had blockage in my leg and I had the surgery, and that's what saved my foot. So the things that stand out for me would be that I had a general practitioner that was aware that I needed to see a vascular surgeon, and a vascular surgeon that was on board and was knowledgeable that I had to have emergency surgery. So in both of those incidents, I am extremely blessed.
Thank you so
Thank you,
much
Pam.
for sharing, Pam. Barbara?
Hello, everyone. Can you hear me?
Yes.
Okay. My story is different from everybody else's because I guess mine is not as serious a condition yet as anyone else's. I guess I'm fortunate that it was found early on, but I had been a very active, health conscious person. I did everything right. I exercised, I ate right, I got plenty of sleep, took care of myself, except I always loved to walk, and it just got harder and harder to walk. It just hurt my legs and feet too bad. And I kept complaining to my primary care physician, and he wrote it off as old age. And I had recently become a widow, so everybody blamed everything on anxiety and depression and didn't want to treat anything else. But when it finally got so bad, all he had to do was just put his finger on one point, and he didn't feel the pulse. And he said, "You need a vascular surgeon." I didn't know what a vascular surgeon was. He asked me, I'm in a real small town in South Georgia. I have two cities, one north and one south, either one that have excellent hospitals and doctors. And he said, "Which town do you want to go to? Because you're probably going to have to go to the hospital." So I picked the one where I liked the hospital better. Of course, I was supposed to get an appointment with the doctor who had been around a while, was very experienced, but he had brought somebody new in with him who needed to fill up his patient file. So I got the new doctor. I didn't find out till a lot later how new he probably was. I feel like he is a very good doctor. I have confidence in him. He's a very nice person, but I don't think he knows how to communicate with the patient, at least not with me on my level. I'd never heard of peripheral artery disease, PAD. I mean, he was throwing all these medical terms at me that I didn't even know what they meant. He tried to explain everything to me, but I guess I'm one that I needed explained over and over and over. And I need pictures, and I need a brochure, and I need something written out. And I was just kind of in shock. All I knew was that I could not walk, I couldn't go on long walks on the beach anymore without pain. I couldn't go hiking with my grandchildren anymore. I wanted my life back. And I said, "Whatever you can do, please do it to help me." And so the first thing he did was the Arteriogram, which you can call it several different names. I didn't know what he was going to do, except that he was going to go into my leg and do something, depending on what he found. So I guess the whole time I was kind of in shock. I didn't know enough about anything to ask questions. I just did what I was told, and found out later that I think I was one of his first patients. And that day, now he had had to help the other surgeon in an emergency, so they were really far behind getting to me. After the procedure, he didn't even come in to tell me what he had done or what outcome. He went back to his office, and I asked the nurse, I said, "Is the doctor going to come see me?" And she said, "He's new and he's gone back to his office. Let me call him." So he came back, and about all he said was, "I'll tell you all this stuff with your follow-up in 2 weeks." Now, I also knew I was going to have the other leg done. So, for 2 weeks, I just didn't know. And he told me, he said it would not be a complete cure, that it would help, blah, blah, blah. I still didn't know what I had, really, what the eventual outcome was, why we were doing this stuff. I just didn't know. All I knew was my legs hurt and I couldn't do what I used to do. So that was my first experience. And still, this was almost 2 years ago, and I still feel like I'm in the same position.
Yeah, I would venture to say, Barbara, that you're not alone. I think a lot of people, when they're newly diagnosed, they feel like, I mean, it's a shock, right? There's that, you sort of come into this mental fatigue of just like, what's happening? This is not something I expected. So there's that time that you need to adjust, but then you're also having to learn something new. So I would venture to say that you're not the only patient who feels that way when they receive a new diagnosis. And I think that you bring up a good point about they're just, you know, I think there's opportunity for better communication tools when it comes to inviting a patient into the, you know, delivering that kind of news, right? It's, you know,
Right.
and putting ourselves in the shoes of a person receiving news that they never, that they not totally expect, right? No one expects to wake up and you're walking just fine. It's, you have normal mobility, and then all of a sudden it starts hurting. That's not a normal thing in your day-to-day purview. So I think that's really important for you to point out. And I think there's opportunity there for sure for us to collaborate better on how we communicate.
Mhm.
Absolutely. All right, let's end with Peter. Again, what are some things that stick out in your mind that went well with your initial interactions with your healthcare provider, or in your case as a caregiver?
Yeah, I guess I would actually like to echo a lot of the sentiments of what Barbara brought up. It's what actually stuck out with my dad, who has
His picture's not on here.
actually a bunch of different issues, and PAD as well as CLTI. But the thing that stuck out that I remember the most was once when this was after he was diagnosed with heart condition. He has coronary artery disease, which led to him being later diagnosed with PAD and CLTI. But he was actually admitted to a emergency room later on because of a TIA. He had a mild stroke. And the thing that stuck out the most was when the doctors asked at the emergency room, who are the doctors that your father is seeing, and I mentioned all the names, and I mentioned that he's not seeing a neurologist. This is the first time that he's had a stroke, but he sees a cardiologist as well as a vascular surgeon. But can we, will they be notified, and will they be able to, come in and see him? And the reaction of the emergency room was almost that they almost laughed in my face, in the sense of like, no, they're not going to show up just to see your dad, and kind of mumbling, almost saying that they have dozens of patients, they don't have time to basically go see every patient in the emergency room. And I kind of understood the logistics about it, but I also felt like that was a big, I guess, downfall of the medical care system, is that they don't have time to see a patient. And I didn't know little to nothing about, obviously, strokes. I knew nothing about little to nothing again about all these other issues. But I wish that someone would have come and talk to me and my dad, and actually seen my dad, someone I can talk to. That neither the cardiologist or the vascular surgeon reached out to us until days later, when actually my dad was actually back home, and I actually had to do the reaching out to them. They never reached out. All I left emails, voicemails, paged them, things like this. And they basically, when the vascular surgeon finally did call back, he was basically saying he's doing us a favor by calling us back, that this was not normal to follow up in this manner, and because I left a couple messages, he did me a favor to follow up. And I was, again, dumbfounded by it. So that's the thing that stood up, is that the follow-up was kind of my onus. It was my responsibility to try to follow up with them. And on top of it, that it was not their normal protocol to do this, and they didn't talk to each other. Neither the cardiologist was talking to the vascular surgeon and vice versa. And even the weird thing was our insurance company didn't know that, who we were talking to. So that's what stuck out, was the lack of communication and the lack of follow-up from the physician. So that's what really stuck out. And I realized that kind of we're on our own here. It's just me and my dad, and we are the ones that have to kind of find this information and do all the legwork. The doctors either don't have the time or the inclination to do it. So yeah, that's what really stuck out and really left a bad taste in my mouth.
Yeah, Peter, I think there's, like I said, we have opportunity to break down some silos and really look at this from a multidisciplinary perspective. And, there are foundations and organizations and even, researchers and experts who are thinking through that. What does it look like to have a multidisciplinary team to look at how, prevent worse outcomes? So I'm a nurse by training and trade. And I used to work at a pediatric hospital. And I remember, I don't know if anyone's worked at a pediatric hospital, but when a child is diagnosed with a disease, right, a diabetes, they come in, there's an actual person who comes into the hospital and brings, a book, a story, and maybe some models to talk through like what that diagnosis is. I'm not equating that, obviously what I'm thinking about that because of the time and care that they put into making sure the child is understanding of what's going to happen, what are the next steps, but what's scalable, right? Like, how can we apply a similar method when it comes to diagnosing adults disease, right? Because adults are not experts in medicine. And I think there's opportunity to look at how we approach how we diagnose someone and how that impacts their day-to-day life and how it is difficult to navigate the healthcare system. So I just want to resonate with what you said, Peter, and I do think that there's opportunities to improve that.
Thank you.
Thank you all for sharing. The next question is, what do you wish you would have known about your disease beforehand? What are some things you would like to hear from you or your family's healthcare provider? Let's go ahead and start with Barbara.
Can everyone hear me?
Yes.
I guess I just wish I had known there was such a thing as PAD. I knew I had high cholesterol, but I could not take medication for it. So I just relied on exercise and diet. I didn't have diabetes. I didn't have high blood pressure. I didn't have any of that. But I think and now people don't even know there's anything wrong with me because there's no outward noticeable signs. It's just, if somebody asks me to go for a brisk walk and I can't keep up with them, they wonder what's wrong with me. So I think the public needs to be made more aware that, when you have high cholesterol, it can mean that the artery in your leg is going to close up and it's going to hurt very bad. And, I don't know what could happen here on out. Even I know when one doctor talked with me, not the surgeon, but the other one, because the surgeon wasn't in office that day, he said, "Don't worry, you're not going to lose your foot, but it's going to hurt." And it's just, like I say, I still don't know a lot. I tried to read online and find out more, but one medical term will use another medical term to define itself. I mean, this means this and this means this. So it doesn't do me a whole lot of good. I have to go back to the beginning and read. I didn't know what this CL, whatever.
CLTI, yes. We're all still learning it too.
Don't know. I've never thought about the circulation in my legs, how it could be limited. I was just too active and too healthy a person. And like I say, I think it probably shocks a lot of people, because when I told people what I was going through and what I was doing, they said, "What? I don't know what you're talking about."
Mm-hmm.
So I don't know how, if the public is not interested in knowing more about it, I don't know if maybe even your doctors could talk to, if you begin to have any kind of cholesterol problems or heart problems or whatever, it seems like it's in, everybody wants to zero in on the heart, because I always thought, okay, maybe with high cholesterol, I can't treat it with medication. Maybe I'll have a heart attack one day or a stroke. I said, I'd rather have a heart attack because they can treat it and I can be up and going again in no time at all. It didn't scare me. I said, I just got to live with this. When you start talking about my legs hurting every time I try to do something, and it's going to limit what I can do the rest of my life, which I'm beginning to figure that out. I would have liked to have had a little forewarning about it. I think the vascular field, I don't think people know enough about. That's all.
Absolutely. And that's why we have Vascular Cures doing that work and trying to like really push the public's knowledge on, vascular diseases, because you're absolutely correct. Everyone hears about the heart and diabetes, but there's a whole nother component of this. So thank you so much. All right, Pam, again, what would you wish to know about your disease beforehand, and what was something you would have liked to hear from your healthcare provider?
You're on mute, Pam.
Thank you. I would have to piggyback off of Barbara. She said it best. I would have just liked to have known what PAD was and make the connection. I am diabetic, but I had no knowledge of what peripheral arterial disease was, nor the fact of the circulation of my legs. And I think that Vascular Cures and panels like this are getting the word out and educating, and the things that we are moving forward to make sure that things like this don't happen to others, and that we are educated is really important. I would have also liked to have known that smoking was directly connected to PAD. I could have stopped smoking a long time ago if I had known. Being a PE teacher, it was really important. And I look back on my family history with diabetes on both grandparents' side of the family, double amputee grandmother, double amputee aunt, single amputee, another aunt. I can go on, and no one in the family made the connection with PAD and diabetes in this realm. It wasn't until recently, me doing studies and everything and trying to now educate my family as well as other people to the importance and how we can prevent this. It's all about prevention. Being an educator, I'm going to say education is key. So you said it best, Bob.
Pam, and not to put you on the spot, but don't you have a podcast that you're working on?
Yeah, the podcast is done. Okay.
Oh.
The podcast is out with Dr. Via Bland.
Oh, okay.
I don't know exactly where you can go. I can send it to you, but it's been
send it to me.
completed. This been completed, and the thing I'm working on is my children's are doing a formulation of teaching a lesson on PAD and CAD. So I teach my 3rd, 4th, and 5th graders what PAD is. I believe that is important, as we did with the DARE program and the stop of smoking, that we do the same thing and be educated as far as what peripheral arterial disease is.
That's wonderful, Pam. Thank you.
Thank
for all
you.
the work that you do.
Yeah, I agree. Education is one of the key components of prevention, right? If we can prevent it, we don't have to treat it. And, that's great. Thank you so much for sharing. All right, let's move on to Kim. Again, what do you wish you would have known about your disease beforehand, and what would you would like to hear from your healthcare provider?
I want to piggyback off of what Barbara and Pam said about diabetes affecting your circulation and causing PAD. I mean, my mom went years with wounds, but they put more emphasis on wound care than circulation. Well, if you don't have circulation, you can't heal wounds. And ultimately they were able to heal them, but it was like long, ongoing processes. And like I said, where I lived, they probably were working with the resources that they had available in town than sending somebody like 2 or 3 hours away to see a specialist. So it wasn't until it was life-threatening that my mom saw a cardiologist and things like that. So, I mean, I agree, education is important. Making PAD one of the criteria when you have diabetes, maybe you can start processes like ankle brachial indexes and Dopplers, and doing that kind of thing earlier. And when you have wounds, automatically sending somebody to a cardiologist, not waiting, just send them to wound care or infection control, or the infectious disease doctor for a wound, instead of checking circulation. So, like, I'm kind of piggybacking off of what everybody else said, the importance of knowing what to do. How knowing what to do is important.
Yeah, absolutely. And I think that's helpful for us as students. We're learning, we're in the early process of learning what to do when we see a wound or seeing patients with PAD. So this is a good reminder for all of us that are students in the panel and the audience to keep these things in mind as we go through our training. Thank you so much, Kim. All right, Peter, you'll finish us off. Again, what would you have liked to know about your disease beforehand, and what would you have liked to hear from your healthcare provider?
Yeah, I think I have a similar, experiences that the other participants have. I think the thing I would like to kind of bring up is that my dad, much like myself and a lot of people in my family, is what you call a bad patient. And what I mean by that is that we rarely saw, he rarely saw his family doctor. He's the type of person, I think I mentioned before, that to Linnell, is he would only go unless it's like absolutely necessary. If a bone is sticking out of his leg, then that's the time to go to the doctor. Everything else is, it'll work itself out, basically. He didn't like to take medicine. He definitely didn't like hospitals, didn't like to go to the hospital, didn't like checkups. I think what I would have liked is that, when he did, see his doctor, that they would really talk about how important preventative medicine is regular checkups are so important, that, we have a history of heart disease in our family and diabetes, and even, again, strokes. So, but that was never kind of really, drilled into him. And he still believed that, it's just going to work itself out, which, it doesn't. It's not what they call country medicine. It's like, oh, just keep the fever down and drink a lot of fluids and, it's going to go away. It's not a cold, but people in the old school way of thinking, the olden days, that's what my dad believed. And I think that we need to change that. We need to change that mindset, that belief, that, it's just like what even Barbara brought up, that we brush it off as it's just a sign of old age. It's going to happen no matter what. I think that it doesn't have to be that. It doesn't have to be. It's going to eventually happen no matter what. So it's, we could just let it go. It's not a big deal. I think there's a responsibility from people that are caregivers like myself, but also responsibility from doctors like yourselves, that you should be, again, fostering or shepherding the idea that, preventative care is just as important, if not more important, than retroactive care. So I wish that would have happened, and I wish that, obviously, I wish my dad would have followed more directions, but I wish that the doctors would have been more aggressive with their, recommendations and their stance about, you need to do this, or you're going to, suffer the consequences. I think I don't want to put the blame on them, because a lot of it is on my dad for not listening, but I think a lot of it was on the doctor for not, making this as an urgent priority, for him to do, preventative healthcare. Again, getting tested, not, getting his blood pressure checked often, not controlling his blood pressure, I knew nothing about what a PAD was or a DVT was, I think educating me as a healthcare, as a caregiver would have been great. Talking to each other, educating myself. helping me educate myself. I don't think they put the onus on me either, that I should, try to be, more of a, what's the term? A beginning caregiver. I waited just like my dad until it was a little too late to be a caregiver. I should have been more, proactive about it, knowing that he's getting older. But yeah, I think that would have been great if they, urged upon me to look after my dad a little bit more and to look for warning signs more. And I clearly didn't, so yeah. I wish that would have been something that they would have impressed upon me a little bit more.
Okay. Thank you, Peter.
Yeah, absolutely. And I think everyone kind of shares the same sentiments, right? Education and prevention, which is a great segue into our next question. What do you believe should be emphasized from a public health standpoint so more prevention can be done rather than treatment of vascular issues? Let's go ahead and start with Kim.
Education should be emphasized. And I'm hoping, like, working with Vascular Cures, we can go out into the community, to community settings, and inform the public about PAD and CLTI, churches, health fairs, things like that, and just getting awareness out there to people personally. I think that is very important. And making sure, like, your family practice doctors know more about PAD and know what processes to go through. Because I'm speaking, like, from my experience, I don't think that, my mother's family practice doctor knew exactly what to do next with her situation. But then too, with her, when she really started having problems, it was, her situation was CLTI, so it was life-threatening. So really getting out into the public, making everybody aware, is very important to me. I think that's most important about public health.
Yeah, absolutely. Barbara, over to you. What do you think should be emphasized from a public health standpoint so we can do more prevention? You're on mute.
I think Kimberly said it all in what she had to say. I don't know that I could add a whole lot to that.
Mm-hmm.
Only thing I'm thinking about is, me as part of the public. I still feel like that I have not been told anything about prevention. I haven't been told anything about what to expect in the future. And if I'm as dumb about it, having the disease, I think we've got a long way to go to explain it to the public. I don't know, maybe all of us that have the disease need to start handing out brochures or something and say, listen to me, look at me, let me talk to you a minute. Only I don't know what I would say to another person, because nobody's ever talked to me about prevention, or, there's no follow through with my situations. There's never been the follow through that I thought, follow up I thought I should have. And maybe it's my fault, like Peter said, maybe we're supposed to be the ones who initiate everything. But, when my doctor assigned me to 12 weeks of vascular therapy and didn't order a follow-up visit, and he was the one supposed to be getting the results of all this, why did I even do it?
Yeah, and if I could just emphasize a point here, Barbara, there's no such thing as being dumb when it comes to not knowing what you don't know, right? There's only everybody is a beginner at some point when it comes to knowledge. So, I think when it comes to shared decision making, I think this is, again, an opportunity for patients and providers to communicate a little bit different. And when we were designing our educational materials, we had that in mind. We understand that the day-to-day experience of a patient isn't always captured in a 15-minute visit. And so it's really important, you know, for patients to know that they are experts in their experience and in their health, right? And what they do on a day-to-day basis. And they can then bring that to the table to have a mutual conversation with a provider so they can work. It's like troubleshooting, right? You know, when you go to a mechanic, they ask you what's wrong with your car. Well, it's making this noise. It's been doing this for a few months, you know. So it's really should be this collaborative effort between patient and provider to figure out how to best navigate that.
Can I say one more thing that I
Yes.
thought might help be an answer to this? I saw, the way I found out about Vascular Cures, I think they had something on Facebook. And I thought it was some kind of support group for other people who had PAD. And I thought, well, I'm going to join this because maybe somebody can help me understand what it's all about. And then, you know, found out it wasn't exactly that. And the first program that I participated in was very frustrating because it was doctors and researchers and teachers throwing out medical terms to each other, trying to figure out what their end result was. They were concerned about what they were going to report and how they were going to report it. It wasn't, they didn't ask the patients anything, you know, well, let us talk to one another. Or so I think patient interaction could help a lot.
I agree.
Yeah, absolutely. And I hope this panel just shows you that your voice is very important. Patient voices are very important, yes. And you should be just as much as a part of the decision as your provider. Alrighty, Peter, again, what do you think should be emphasized from a public health standpoint?
Well, clearly, I think, again, I think prevention is, you know, I think the key. But I think the thing is this, I think just like anything to do with health, I think the earlier the better. And when I say earlier the better, I think just like eating healthy or living a healthy lifestyle, I think it should start when you're a child. I know that sounds weird now, but I think, you know, like teaching a child to eat healthy or have an active lifestyle should start when they, you know, start to walk, when they start eating solid foods. I think when it comes to this, you know, it is building a lifelong, you know, habit of a healthy lifestyle. And I think that should be the most important public health concern is, you know, to avoid disease before, you know, having to treat disease. Much like in your question, I think prevention is better than treatment. I think there has to be a shift in, you know, I think just the philosophy of how we raise, you know, our children, you know, to build a new, you know, I try to raise my children again to, you know, as an example, not to be like my dad or not to be like myself, that they should start living healthy and not wait until, oh, well, now you're overweight. Now you have high blood pressure. Now you have this, then treat those conditions before it goes into, you know, a heart attack or a stroke or a PAD or, you know, diabetes. Treated before it even gets there. You know, I think right now we're still treating, you know, the symptoms, you know, the diabetes, the being obese and, you know, having high blood pressure. We're treating those. I think we should, as a public health concern, we should treat it before it even gets there. I know talking to Linnell, I can't believe that my dad's earlier on, you know, and I know a lot of Asians did this. They were somehow proud to tell people that they had high blood pressure. Like my blood pressure is 180 over 100. Like that's not something to be proud of. You know, you shouldn't be. That's not something you want to talk about and be, you know, boast about. But
right, highest doesn't win.
Yeah, it's not
highest blood pressure doesn't win.
Yeah, it's like golf. The high number is not a good thing. You know,
yes,
so
thank you. Yeah.
You know, doctors would probably agree with that since they play so much golf. But I think there should be a public shift in, you know, how we treat, you know, I think it's information early on, I think is the most important thing. I think that should be the shift. I think that there should be more emphasis, even the pediatric ages, you know, that kids should be seeing their physician more often and take care about the blood pressure even before, because you think blood pressure is only, after 30 is you should worry about your blood pressure, you know?
Yes.
Your sugar intake, your salt intake, these things, and having an active lifestyle. I think that everybody knows, it talks about what, 30% of kids are obese, you know, it's not a
Yes.
good number again. So I think that's the most important thing is publicly is to, even before you get to the high blood pressure, before it moves to PAD or CLTI, before that, I think it needs to kind of be drilled into people that the first doctors actually should be the parent, you know, and that information should come from, you know, the OBGYN, you know. So yeah, I think that's where public health should start even prenatal. I know that
Yes.
sounds maybe a little too far-fetched, but yeah.
Yes, thank you, Peter.
Absolutely. And then Pam, again, you'll end us off. What do you believe should be emphasized from a public health standpoint?
I think that we need to do, I'm listening to everybody and I agree with everything that everyone says. But before we can get to the prevention aspect, we have to be aware. The awareness needs to be made first. Once we are aware and we have an understanding of what the disease is, because I had no knowledge of it, but being that now I am aware and I have knowledge of it, I can put an understanding to it. From the understanding, I can make a connection. My first connection was with Vascular Cures, which gave me information. Then you can have a connection with all of the other surgeons and doctors that are involved, whether it's other different diseases, it's cholesterol, or however, podiatrists, the things that we need to formulate that team of things that can be done. Then we put in the prevention aspect once we know. People are not going to want to prevent something that they do not know what it is, or they do not understand it. So I think we have to go with the awareness aspect too, is what you're doing. That's why it makes this so phenomenal to have how many ever students it is. I think someone put in the chat room that there are only 93 vascular surgeons. Well, based off of what the system is just right here, that's not enough to cover the people that are part of Vascular Cures. So we have to really go out. We need more students to get involved with that, more of an understanding. I agree, being an educator, that children need to understand. That's why I make it part of the curriculum now. And then I'm hoping that me making it part of the curriculum will pass on to other health educators to make it part of their curriculum. That is the beginning. So if they understand, they're watching grandparents, they know who's smoking, they know who has diabetes, the children, they go, I know because parents contact me and say, look, the next time you get ready to have a lesson about, can you let me know? Because kids are going to hold them accountable for what the things that they do. And that's extremely important. So as we hold each other accountable, then the children can hold them accountable. I wanted to say one more thing. Barbara, you're on to something. I think it's up to you to start an advocacy group for those of us who have PAD. You can do that format right there on Facebook and get exactly what you need. I would join, and I'm quite sure Kim and Peter and a lot of other people that I know out there would join, because we need a floor and a platform to be able to communicate with each other. Figure out, this is for us for the rest of the life. What works? I know that there's, I can't call his name right now, but I know he helped me a lot with my walking and the things that he does to push through so that he can walk more. Those things are important, that when we get, and that's what's missing with the Zoom aspect and not the face-to-face. Because after we would have a panel, then you and I would be able to sit down and talk. And you could tell me what you have going on, and I could tell you what works for me. Peter could say what works for his father. Kim could share what she did with her mother. Those things are extremely important. And Barbara, you can do that. And I am here for it.
Me too.
Pam, have you ever considered being a motivational speaker?
You know, I get that a lot. My gift is my children. I am a walking billboard. And that's what I do. I can walk into any room and 300 to 500 children and it shuts down. That's a gift. That's you can't train for that.
Yes, you know, I love it. I love when Pam preaches. And you know, Barbara, if you are interested in starting your own group, we do have patients who have done that. I'm happy to connect you with other patient partners. And just for everybody who's on the webinar, Vascular Cures is a Patients as Partners program. And the program is for patients, caregiver advocates. So anyone who is passionate about sharing their story and experience, which we try to leverage into engagement opportunities like this. You know, we want to bring them to the table with decision makers or future decision makers, like the students here that are part of this webinar, so that they can use their experience, because patients are experts in their own experiences. And I think it's powerful for, you know, helping to improve vascular health outcomes for all. So, you know, on behalf of the Vascular Cures team, we appreciate all of the attendees of this webinar for taking time to listen to our panelists this evening. You know, we hope that it was a meaningful experience for you, as it was for us. I always love hearing patients collaborate with each other, and especially, you know, having students here. I love students. I think that you guys are the future. And you know, thank you so much for giving us your time. I want to give a special thanks to Stephanie Liu and Stacy Peralta for being rock stars. I know they've had a busy clinical, and Stacy just came from having a quiz and they're still here. And so thank you so much for coordinating this event. I want to do a special shout out to Dr. Shi, who is their advisor for the public health program. And, you know, thank you for connecting us. And, you know, David Armstrong, I think he left already, but if it was not for David Armstrong, I would have never met Dr. Shi, and I would have never met the students at the School of Podiatry. And on a final note, you know, Vascular Cures is the national 501c3 organization, nonprofit organization, and our mission is to innovate patient-centered research, catalyze breakthrough collaborations, and empower people in their vascular health journey. If you'd like to volunteer, this is a shameless plug here. If you'd like to volunteer or partner with us in the future on collaborations like this or events like this one, if you're a patient, provider, future provider, please send us your name and contact information on the event survey link that Stacy is going to add now on the chat. You can complete that survey. You can fill out your name and your email address, and I'll reach out to you. My name is Lynn Nell. I am the Director of Programs Empowerment, and I manage the Patients as Partners program and events like this one. So, you know, we're always looking for more partners, more students to help impact vascular health outcomes for patients and to improve it for all. So thank you again for your time, and good night. Thank you. Thank you for being here.
Thank you.
Thank you so much.